I'm Dr. Mistry. I am laparoscopic surgeon. So I basically do bariatric surgeries and all the laparoscopic gastro-intestinal surgeries. I've been a surgeon for last 10 years. I've gained my training from India and France. And for last 5 years, I've been working in Nairobi. Bariatric surgeries are procedures by which we usually alter the anatomy of stomach and intestines. So it helps make some hormonal changes in the body. Patient don't feel a lot hungry. Their metabolism can go up, so they start burning more calories than, compared to what they put in their body. So over time, they start losing their body weight, specifically the excess fat from their body. There are basically two types of bariatric surgeries. One is called sleeve gastrectomy, where we cut a sleeve out of the stomach and make the stomach size smaller. So what that does is the part of stomach which releases the hunger hormones, they get reduced, helps patient have reduced hunger, and also the stomach size goes down. So it forces them to have a healthy lifestyle, not eat a lot, have healthier food to maintain their nutrition, and they usually lose up to 25 to 30% of their weight over next 1.5 years. The other surgery which we do is a gastric bypass, where we not only reduces the size of stomach, but we also bypass a part of intestines, which induces more hormonal changes in the body, increases metabolism in the body. And with this surgery, they usually lose more weight. It's up to 30 to 40% of their weight, and they lose it up to 2 years. Usually we show them certain pictures about what we do, how we do, because this is a laparoscopic surgery, it's not an open surgery, so there are no big cuts. Usually patients fear about big cuts, but we do these surgeries with keyholes, so there are small 5 holes on your tummy. With that, surgery is done. We also ask them if they have any doubts, we explain them, we prepare them about post-operative expectations. So usually after a good counseling, they are satisfied. We also do an endoscopy to assess condition of the stomach from inside, because there can be certain contraindications for the surgery. If that stomach is having certain diseases, you cannot operate on such stomach. So basic blood test and endoscopy are the must investigations. Some super obese patients, we also need to assess their heart and lung condition, because once someone is obese, it also affects their hearts and lungs. So we need to check their suitability for the surgery, because the surgeries are done under general anesthesia. If we find something, first we have to rectify it. We have to get them to our physicians. Once their heart, lungs conditions are okay, then we take them for surgery. Patients are smoking, we ask them to quit smoking for at least about 6 weeks. We encourage them to change their diet even prior to surgery, so they lose some weight even before surgery. That helps them maintain that dietary changes even after surgery, because sudden changes are always difficult to maintain. Apart from that, just the basic investigation which we do. If we don't find any other things, they don't need any special preparation. They should be fasting for about 6 hours before surgery. Usually we do these surgeries in the morning, then they are fasting overnight. They come early in the morning to the hospital, and they just acquaint themselves with the hospital, and within an hour or two, once they are settled down, we take them to the theatre. There are certain risk factors, but the risks are usually low. I would say it is less than 2% in the literature. When we alter the stomach anatomies, there can be some small leaks from the stomach. When patients are obese, they tend to develop a condition called deep vein thrombosis or pulmonary embolism, which happens, which means that they develop some clots in their leg or in lungs. But the incidence is less than 2%, and we usually do take care of it with certain medications and certain prophylactic measures before surgery. Specifically, patients who drink alcohol or addicted to alcohol, it's difficult for them to manage. So that is why we encourage them to get off the alcohol before surgery. If they can manage it for at least 3 months, probably they can manage it further. But if they haven't done it, then yeah, alcohol is the strongest risk factor, I would say, which can make them gain weight even after surgery. The most common misconception I have heard is it's a risky surgery and people tend to die after it, which is a very wrong thing. The death usually occurs in 1 in 1,000 cases. So it's a very rare occurrence. Other is we need to educate people that it's a slow process. You lose weight over next 1 to 1.5 years, sometimes up to 2 years. So it's not a fast process. So it's not like that once you come out of the theater and you can expect weight loss immediately. So these two are the most common misconceptions, but we explain patients about that. Many success stories, like one of my patient who lost almost 40% of weight loss after gastric bypass. She's an TikTok star. She has many followers, so she's very happy because she lost the weight and people are appreciating her. But obviously, we cannot share their name. It's confidential matter. In Kenya, there is a good, very good reception for these procedures, and I see the obesity is on rise in Kenya, specifically in the major cities like Nairobi and surrounding areas and Mombasa. Not so in the rural areas, but because of this Western lifestyle now, the obesity is on rise, but patients wants to get back to their normal healthy lifestyle. So yeah, they are curious about it and they are opting for it.